Good afternoon, everyone. I am CA Dr. Sanjeev Singhal. I am the Central Council member of Institute of Chartered Accountant of India and chairman of the Public Relation Committee of ICAI. We have assembled together to listen to a great personality who has bring laurel to our beloved country, India, and who's a great human being, saved thousands of lives. I had the opportunity to briefly interact with Dr. Naresh Trian when I was in industry at Jubilant Life Sciences. It is so heartwarming that we approached his office, and in no time he agreed to spare his most precious time. Thank you so much, sir. Sir, Institute of Chartered Accountant of India has 4 lakh members and 8.5 lakh students. So whatever you talk today will reach to 12.5 lakh families, sir. And through this webinar, sir, the Public Relation Committee, wants to basically bring awareness for our members on the heart conditions. We have also done a program on the burn management and the first aid, where Dr. Manish Singhal, who is the chairman of the burns department at AIIMS, was there. Of course, Dr. Trian doesn't need any introduction, but he's the chairman and managing director of Medanta Hospitals. And Dr. Trehan is the heart and soul of the cardiac care expert. He's a world-renowned cardiovascular and cardiothoracic surgeon who has been awarded the highly prestigious Padma Bhushan and Padma Shri by the Government of India. And he has saved over 48,000 lives through successful open heart surgeries. So without further ado, I know that all of us are very, very keen to listen to Dr. Naresh Trehan. Let me request Dr. Trehan to please address us. And sir, 175 branches of ICAI in India and 45 overseas chapter joined this webinar. So we'd request you to kindly deliberate. And then once your session is over, we'll take up some selective question depending on your time, and we'll take up those questions, sir. Thank you so much for giving us time, sir. Thank you.
Thank you. Thank you so much for your long introduction, which I'm not sure I deserve, but anyway, thank you for the compliments. So this is an honor actually to be able to share with you whatever we know about heart and health in general. So as there has been a sort of reminder to us every week or two that apparently healthy people who have been leading a kind of a healthy life by way of eating right, exercising, doing yoga, all these people dropping dead suddenly, either doing bicycling or maybe dancing on the stage or something like that. So every few weeks we get this shock. And that has actually created this kind of fear in everybody about, do I have the risk as a person to be able to be suffering from a sudden heart attack and losing my life? So I'm going to talk about basically the state of medicine today and how we can actually steer ourselves through this maze of disease and what we are doing as a medical profession to make it even more accurate in our diagnostics. And so let me start with the fact that we became doctors to treat disease. Then we said, why let people get so sick? Why don't we do early detection? And that's the era where all the familiar words that you've heard about CT scan, MRI, and all the stress tests and all that, echocardiography, this all developed in that period where we thought that if we check people in time, then maybe we can catch the disease early and treat it accordingly so that the outcomes are also very good. Then once we had done that, we said, why let people get sick at all? And that's when the era of wellness and preventive health started. Now, with a lot of enthusiasm, we as medical professionals went out there, gave lecture after lecture to people what to do, what not to do, what is healthy, what is not healthy. And the whole thing that when we look back, we realize that only 3 to 4% of the people have actually accepted this methodology that we gave to them. And the reason being that what we did was we painted the whole population of the world with the same recommendation. This is not good for you, don't eat this. So all that stuff went down. Yes, people want to live. So their adoption of our recommendations was very poor. And then we started thinking, what is that we can do to actually make it more effective? So now what we are doing today is we are actually culling out people who are at risk of a certain disease that may be already prevalent. And how we do it is genome sequencing, that is your gene sequence of each individual, is now possible at a very low cost. It used to cost more than 2 lakhs of rupees. Today it's come down to less than 20,000. We combine that with the phenome. Phenome is what we call a body structure, sleeping habits, eating habits, stress levels, exercise levels of an individual, their weight, their height, whether they are obese or not. So that's the phenome. And then we add digital health to it. And digital health means what we have measured in your blood tests, in your stress echoes, in your blood pressure, all that stuff that we had. So we make now, throw all this data into one piece for an individual, and algorithm appears for an individual to say, these are the risks that you are prone to. And this is what you should be practicing to take care of your individual needs. So in other words, it becomes what we call precision personalized medicine. In other or put it more casually, you can say we can make the health horoscope of an individual today with a great degree of accuracy, because the gene sequencing has helped us to identify who are the people who are vulnerable, because polygenic gene sequencing has also made it possible for us to identify people who are at a higher risk of heart disease. Also, the combination with phenome and other modalities that I talked to you about digital, it can tell us about people who were pre-diabetics, people who are hypertensive, and also to some degree cancer detection early in these patients, because the genes express the vulnerability of an individual to a certain type of cancer. So all this knowledge having come out recently, the possibility of making that Janam Patri, what we call the health Janam Patri of an individual, is possible today. So that means that it also not only that we want to do it, we also want to make it participative, so that the individual understands where the risk factors are. So in other words, if you take a full population of an area, there may be 4, 5, 6% people who will require this kind of modification of behavior, and also the cautions they need to introduce in their life. Because you can see now, if all the other factors that led to disease were not enough, the environmental issue of pollution, air quality, all that stuff has added on to our risk for developing disease. So, having got that background now, let's talk about how does one as an individual assess themselves. So we say first, recognize your gene, which you can do yourself. So if you have heart disease in the family, then there is a double the chance for the children of that family to develop heart disease. That means if you have, say, one parent has heart disease, and the current estimation of our population is that 10 to 12% people will get heart disease, then that individual who's born in that family the incidence will become 25%. And if, God forbid, both parents have heart disease, then it multiplies again. So you can go near 40, 50%. That's for heart disease. So you know whether you are born in a family where there is genetic history. Of course, we can now also analyze the genes. And then we can always say, you are vulnerable for this reason. And then hopefully the adoption will be much better by those individuals who have been identified to have that risk. So what are the risks that can be identified? There's a risk of heart disease, there's a risk of diabetes, high blood pressure, and also cancer. So some of these things will contribute to warning a person of how careful they have to be. And some of the rest of the people who do not show any of these tendencies, we can be more relaxed with them. You know, what happened was we did a very long study known as the Framingham study, which lasted over 40 years. And 50,000 people were actually followed meticulously for 40 years. And then when we realized that our notion that eggs were essentially, or cholesterol which is eaten, is essentially bad for the body or for heart disease, that was not true. That it is your internal cholesterol levels of your own biochemical makeup which will decide how much of a risk you have, but external cholesterol contributes very little to it. So then Eric Topol, who was the chairman of Cleveland Clinic and chairman of the study, he said that I apologize to the world that we deprived them of eggs for so many years. But today we say you can have 2 to 3 eggs a week. So there has been some readjustments made by facts and long-term. Should actually exercise more caution than we would allow other people. So there is one point that how you can get a starting point in your life, and that's when we recommend that by the age of 20, everybody should get the first screening of their parameters, whether they are the blood parameters, whether they are the physical testings, TMT, echo. All these things can be done to establish a baseline for each individual. Unfortunately, except for genome sequencing, which costs about 20,000 rupees, the rest of the tests only cost about 3,000 to 5,000 rupees. So it's quite affordable. Once we know what the baseline is, then we can prescribe to the individual how frequently they need to do their tests. So that if everything is okay, we don't see any major risk factors, we would say the next test will be 5 years from now. If we see some risk factors, we will tailor it to the individual. So that's the methodology of trying to protect people from sudden cardiac death or other diseases that may be lurking in the background. So without trying to spread fear, we said, recognize your gene. Second, how do you maintain your body? So that's a long held belief, and it actually works, is that each individual should try to maintain their weight within 10% of the ideal body weight for them. Because if they exceed more than 10%, then we start labeling them as obese. And as obesity increases, so does your risk of developing every disease there is. Diabetes, heart disease, cancer, you name it, high blood pressure, you name it, you are prone to more diseases if you are obese than otherwise. So we are saying always be conscious of your weight, and the best gift you can give to yourself or your partner would be a weighing scale. The weighing scale should be next to your shower. So every day at the same time, you weigh yourself and you know whether you have sinned in the last 24 hours or not. And try to maintain your weight within the parameters which charts are available. It depends on your age and height, that what should be your ideal body weight. And that's the important part. Then comes, what do we do for exercise? Normally what we say is minimum one should raise your heart rate to 1.5 times that of your resting heart rate. So supposing which normally it's about 80 beats a minute, that's the average that people have. So at least raise your heart rate to 120 and sustain it for 15 to 20 minutes a day, 4 times a week. If you can do that, what you're doing is you're priming your cardiovascular system. It's like the flow increases, your heartbeat increases. So the fact is that there is a consumption of fat and also cleansing of your arteries by doing this sustained exercise. So that is cardiovascular exercise. Then, of course, is your muscles, because immunity to the body comes from muscle. So everyone should be doing at least light weights, again 3 to 4 times a week, and repetitive weights, so that your muscle mass stays intact and your immunity stays intact, and your body, the actual curvatures in your body stay erect. So I think that is one of the 2 things that we need to incorporate into our daily routine. Then, of course, is how are we dealing with stress? There is nothing better in this world than yoga for that, and also pranayama, the breathing exercises of yoga. So I have given you a full prescription where half the day you would be just practicing all what I've said. That's not what it's supposed to be. You should at least have 45 minutes to yourself every morning or evening, whichever suits your schedule. In that 45 minutes, if you tailor yourself, one, as I said, 4 times a week, at least 20-25 minutes of brisk exercise, which means either jogging, walking, treadmill, whatever you like to do, cross trainer. Second is that you will do your de-stressing regularly 2-3 times at least a week. And also the fact that if you learn pranayama, that will be your best friend, in the sense that we all get stressed. Stress is omnipresent right now. So if you learn the breathing exercises of yoga and you do it for 2 minutes, you'll see what a great difference it makes to your state of mind. And it's not a mystery, because what we are doing with the breathing exercises is we are delivering more oxygen to our brain. And if you deliver more oxygen to your brain by Alom Volom and some of the other techniques that yoga teaches us, you naturally will get refreshed and your stress levels will come down. Now, dealing with external environments like pollution, poor air quality, all that stuff, I mean, there are no answers for that, except that we all need to collectively fight. And that's one of the things that we need to all do together, so that our living conditions improve no matter where we are living. Because some cities are luckier than others, but places like Delhi, where we live, has got severely poor air quality all the time. So that's like fish living in dirty water. I guess we have got used to it also, but we should fight it all the time. So now let's go to more softer things. Is like the big buzzword today is work-life balance. So this is a trap in life. You want to be good, you want to feel good about yourself, and you want to be excellent. There is no shortcut, you have to work. How you handle that work and how you can steer yourself through your day is something that has to be individually mastered. So if I can indulge in giving you my routine, I prefer to do exercise in the morning. So I will get up around 6 o'clock in the morning, do a good half an hour, 40 minutes of exercise, different variety, including some yoga exercise, at least 4 or 5 times a week, and then run out to work after a shower. And the day usually goes very long, but at the same time, I will do 2-3 times a day, Alom Alom, which is the breathing exercise of yoga. And like I said earlier, it is really a lifesaver. So try it. If you like it, you'll enjoy it. Then, of course, lunch is light. I'm indulging in intermittent fasting from time to time if I see the bulge coming in my belly. And also must incorporate some softer stuff in your life, like music, movies, art, socialization, because if you become unidimensional, that adds more stress. So I think if you want a healthy life and steer yourself clear of disease, then I've given you enough guidelines right now where we can, as I said, make a personalized precision prescription for everybody's life today, which we were unable till genome sequencing came along at a reasonable cost. So now each one of us will have to find our own balance. It's a trap that how ambitious we want to be. In my book, mediocrity is a crime. So you want to strive to be the best in your profession. That's the satisfaction we can all get. And that's what I think, never shirk from work, but find that balance in your life. So I think I've spoken enough. It's now almost half an hour. So should we, if there are any questions?
Yes, sir. Yes, sir. So, sir, there are a large number of questions which you have received. Within your available time frame, sir, I'll ask a few questions, and wherever you want me to stop, I'll stop. We have a large number of questions. In fact, people are watching this along with their family members also. Sir, you talked about genome sequencing. Let me start from there. And as Chartered Accountant Institute, we have a tie-up with Medanta Hospital as well. So, certainly our members, many of our members would like to go for genome sequencing. Somebody has also talked about whether a calcium scoring test or a CT scoring test is also helpful for knowing the heart condition or knowing the calcium deposit in the heart. Sir, if you like to take it up.
So like I said, one shoe doesn't fit all. You have to actually tailor it to the individual. I'll give you some broad guidelines. Yes, CT calcium score is a helpful test, but it should be done at a time when you know that the person is reaching the vulnerable age, depending on their family history and their lifestyle, and whether there is diabetes or not, and if there is high blood pressure or not. So these are all combination of things which will make you do the test at 30 or at 25, depending on what the history is. So that's what I'm saying, that everybody should not willy-nilly go running into a CT for calcium score, but wherever indicated, it should be done. It's a very helpful test. And we have even defined that if the score goes over a certain amount, which we say 440 for an individual, then there is a very high chance that they have critical coronary artery disease. So it is very helpful, no question.
Right, sir. Thank you, sir. Sir, my members wants to know whether getting a stress echo is better or a CT angio is better, obviously keeping also in mind the radiation impact.
Yeah, so the two are they are complementary but not interchangeable. So some people in whom we find that there is a high incidence or chance of having coronary artery disease, for them CT angio is a very good test because it's on it to the degree that you do have to give dye, but it's in the vein, and within 5 minutes you'll get an idea whether there is anything bad or not. So I think from that point of view, it's much more conclusive than a stress echo. But there are times when you say, supposing you go do a CT angio, and you find there are blockages which are 70%, 65%, 70%, 75%. CT angio is not that precise that it will tell you the last 5 or 10% of the blockage. So what may seem like 75% on a CT angio may turn out to be 65 on an angiography. But if you want to clarify sometime, there are two tests available to us where there is doubt about the findings of the CT angio. One is stress echo, which somebody mentioned. The other is stress thallium. Both are good if stress echo is 80-85% accurate, thallium scan will be 95% accurate.
Okay.
But they both will tell you the state of affairs with your heart today, not predictors of future on their own. So that will tell you that yes, today when we exercise you, your heart did not feel any major deficiency of blood supply. It's a very comforting fact to both to physicians and the patient, but at the same time, it doesn't tell you the future that much because you could get more of blockage in the next few weeks, and then somebody will say, what kind of doctor did you go to see who told you everything's okay and now you're in trouble. So we have to do a permutation combination for a particular individual, what's good for them.
Yeah. So chartered accountants are generally deprived of sleep because of the pressure of the work from clients, and also since they sit for long at the many times they end up having a lot of tea or fried snacks, etc. Any tips on the minimum hours of sleep, what kind of ghee or what kind of flour, whether millet, etc. Any recommendation on that part, sir?
Yeah, I'm aware. Fortunately we stand a lot because we are operating all day, which is not what you people do because you have to sit and do your stuff. But there are some modifications you can make. And that is every hour and a half, if you just go get up and take a walk 2-3 minutes, and that's not demanding so much. Instead of telling your peon to get some water, you go and get it yourself. That improves the circulation. That is one. So that protects you from getting clots in your legs. So it's actually saving you if you go and do some little walking in between. The second thing is, as I told you, you're prone to eating all this other stuff, which is, India is a trap by itself because of the fact that the kind of snacks we can get are just out of proportion. There are 100 things that you can get in any given place. So you have to be careful to I always say that nobody says don't eat a pakoda in your life or but do not eat the whole plate. So that's why you want to modify according to you. So if your cholesterol is high and you are a little bit on the overweight side, so then you have to be more careful. If you are exercising, you're slim and trim, you can tolerate a lot more. But one thing that is very important that I want to share with you is we did a very large study on over 15,000 executives who came for the executive health check. 26% of them had high blood pressure, which they did not know about. So this is one of the biggest traps you can get because what does blood pressure do? Much like diabetes, it affects your whole body. Because when the pressure inside the arteries is excess of what is recommended, then it does damage to the organs. So if you see people who have uncontrolled high blood pressure can get a stroke, can get heart attacks, can get kidney failure, which is very important. Similarly, diabetes. These are all dangerous cousins. So if you have diabetes, your kidneys are in danger. Your retina your eyesight is in danger. Your heart is in danger. So once you know that you have a particular thing, then you must go hammer and tongs to fix it. Otherwise, you can't blame anybody else for a tragic end because you knew, but you didn't take care. So I think that this is what I'm saying. Instead of saying to everybody, don't eat sugar, you only say to the guys who have the high blood or tendency for high blood sugar. So we are not advocating that general prescription for everybody. We are now doing more focused, precise prescription for every individual. And Medanta has been doing this, and now it's getting more and more information is coming through. Genome sequences is getting better. Polygenic genome sequences is available now. Our own digital measurements have become much better, much more accurate. So there is a lot to be done.
Yeah, thank you, Dr. So one question is BP and diabetes reversible?
Of course.
High BP and diabetes.
First of all, they are preventable. Because you can tell, you can screen people who have a tendency or will have a tendency to have high blood pressure. There is such a thing as footprints for pre-diabetics. So you can detect people who are prone to diabetes, and you can actually modify their whole life according to prevent them from developing diabetes. Today, if you look at it, as we are talking to whatever number of CAs you have on the line, but more than 7 million Indians have diabetes. And more than 7 million Indians are pre-diabetic who are waiting to get diabetes. So you can imagine that not only that you need to treat the ones who have got it, but you can actually prevent a large proportion of these people who are pre-diabetic from becoming diabetics. So this is where if you pay attention and it's done properly, you can actually make a big difference. So as you mentioned that we do have an arrangement for your members for Medanta. We can do many things. We can even do camps, but you're spread all over the place, I suppose. You're all places, so it's not in one place. So it's not that I can say I'll send 4 people to check the whole membership. So, but we have in Delhi at least, we have one in Delhi in Defense Colony, we have Gurgaon, and many more are coming up right now. So there is in Lucknow, Patna. So there are facilities available, and we'd be happy to try to screen people so that we can prevent them from becoming sick.
Yeah, thank you, sir. Doctor, is jaggery a good substitute of sugar, and similarly, is the millets a better substitute of the traditional wheat?
You know, today for the sake of communication, we say avoid the 4 whites. The 4 whites are poisonous to you, and that is refined sugar. So when jaggery does not qualify in that refined sugar, so there is enough fiber in it also to say, okay, it could be healthy. But then you have to watch your blood sugar because it does have sugar in it, right? It's not like it's devoid of sugar. Okay. Second, we say potatoes. Potatoes are very high in carbohydrates and they are not complex. So they will give a much more extra load. The third is, see, you must recognize the food that we eat has 2 indices in it. One is the complete calories that it has, and how fast does it get absorbed. So you have like I was saying, the first 2, sugar, potatoes, rice, and maida. These are the 4 refined things which will get absorbed very quickly. And glycemic index and glycemic load are the 2 things we talk about. So the rapidity these things get absorbed is known as glycemic. And the total of calories or sugar that adds to your body will be your glycemic load. So always for people who are vulnerable, for people who are diabetic, these are the things they must know how to balance their diet, because you want to eat which has a low glycemic index and a low glycemic load, so that it doesn't, like if you swallow 1 spoon of sugar, your sugar for a diabetic will go up 50 and above because it gets absorbed immediately. Diabetic takes it, it won't go up that fast, first of all, and then it will come down very quickly because the insulin will react. So that's why we say avoid the whites and go more towards rich in fiber and browns.
Doctor, one question is which is coming many times. What are the precautions one is supposed to take after having COVID-19, particularly for heart where there are so many instances of heart attack?
Okay, no, good question. See, what happened was COVID affected people in different ways. There were people who got for 2-3 days and then they felt better and it was like they were otherwise fit, no real comorbidities. So we learned one big lesson was that people who had comorbidities, and that means what we talked about, the blood pressure and the diabetes and lung problems and all that. So comorbidities who had did much worse than people who did not have any morbidities. So that's the fact that they sailed through easier. The second thing is that you got severity also changed, that you would get medium or very severe. So what we did at Medanta was that we did echocardiography because it was discovered that the virus is not only affecting the lungs, it is affecting every organ of the body. So there were deaths being reported. So we did a study on all our patients who fell in the category of severe, and we found 20% of those people had inflammation of their heart muscle. Now, what it means is that if you have inflammation of your heart muscle and you are going to do some vigorous activity or exercising vigorously, then the chances of irregular heartbeat and sudden collapse becomes higher. So what we are saying is people who do get COVID, before you resume heavy duty exercise, like whether you're running long distance, whether you're lifting a lot of weights, or you're bicycling for 40 kilometers or 20 kilometers, then we need to do a treadmill test on you or a stress echo on you to see whether you are tolerating your heart showing any abnormal response when you exercise. So detect it before people get hurt. And that's what happened, that people did not know this. And a lot of our friends, they went back to vigorous bicycling or running every morning, and some of them did drop dead. So I think that's the precaution one needs to take, to know that no permanent damage has been done to any of your organs.
Yeah, thank you, sir. So these days, so many people use the smartwatch. So whether the ECG, which is reflective in those smartwatch, is a good indicator of the heart health.
You know, that's not a multi-channel ECG. So it can give you a little false sort of security. But if you have any family history or any indication that you may have heart disease, we have a device now which is the size of a small cigar. It's a small flat device. So that is, you hold it between your hands and your smartphone will transmit it to our central station in Medanta. And immediately, if there's anything abnormal, you'll be called back and warned that you need to do something. So that's a much more reliable. It will work anywhere in the world. And it will give you 6 leads ECG. So people who have history of heart disease, people who have had a heart attack, people who have an enlarged heart, or who have any irregular heartbeats should be carrying this, because you can do it from anywhere in the world and be warned that you are actually not well.
We would like to know more about that. So we'll get in touch with your team, that what kind of device, its cost and the regular.
It's known as ACOR Alive.
Okay. And the typical pricing for monitoring, etc. Of course, we would like to know it also. So how much of...
I'm sorry?
How much of sleep and water is recommended?
So I am the last, I mean, by example, I can't lead it because I don't sleep more than 5.5 hours or so, max 6 hours if I'm lucky. But you should sleep, for men, should be around 6 to 7 hours. For women, it should be 8 to 9 hours. Because women recharge a little slower. So that's, I think, is a key element of health. So we always say that in the middle of the day, if you can neutralize gravity means that you can put up your legs and sit back in a chair which is leaning back. For even 10 to 15 minutes, the lymphatics which are congested by sitting in long periods get decongested, and that's very healthy for you. So I haven't been able to practice it so far, but I recommend it to everybody. At my age, I guess I'll never get that opportunity.
So, let me ask you at least one more question. This breathlessness and burning of the heart. These are two common things that we see. So, at what point of time we should go and see a doctor?
With the incidence of heart disease the way it is, and it has crossed all the barriers of age, it can be younger and younger also. I just operated, by the way, 2 months ago on a 17-year-old boy with absolutely very severe blockages in the arteries, atherosclerosis. So it's out of whack what's going on as far as this disease is concerned. So I would say one mistake people are making is that because of our diet, which is very rich in spices, that many people will get a little bit of burning in the middle of their abdomen or chest, and then you don't know whether it is from the heart or it's from the stomach. The way to distinguish is you take whatever you have as an antacid or grandmother recipe like Amrit Dhara or something like that to settle, or even Pudina Hara. If it doesn't settle in 15-20 minutes and is still continued, then you should worry about it being from the heart. So I would recommend, and because if you make a mistake, and we know so many people who have made a mistake and lost their life, that you keep thinking that, oh, it's nothing, and then by the time you get a heart attack, you've lost 50% of your heart muscle, and then you're crippled for life or you're dead. So I think that there is one thing you have to be careful about, that if it doesn't go away promptly, and you should have some sort of antacid in your armamentarium at home, that if you do eat late, you have some alcohol and you have spicy food, you get discomfort. But it should settle down very quickly with an antacid. If that doesn't happen, then it's better to take a trip to the nearest clinic or emergency room, whatever, just to get checked out. Because you may have to do it 2-3 times in your life, but it may be one of those things that will save your life. So I think that one should not be consoling themselves. And this is what happens especially to head of families. That men say, oh, what will happen? It can't be me, I'm so fit. And unfortunately in my profession, we see how many people have got hurt by thinking like that.
Yeah. Thank you, Joseph. Do we have time for more questions?
One more, because I got to get back to work here.
Yeah. No, we understand. Joseph, oil. I mean, do you recommend oil, butter, or say cow milk oil, or it should be completely stopped?
No, there's no such thing as you need it. You need oil in your body, because oil is the only thing that the fat is what transcends the blood-brain barrier. So all the vitamins, nutrition that go to the brain have to be based on some amount of fat in your body. So there's no such thing as don't do it. But the main thing is today, we know that there are good fats and bad fats. So good are monogenic and polygenic are bad, and trans fats are very bad. So now what you say is, what is trans fat? Because that's what the frequently asked question. Trans fat is fat in which refrying is being done. So that's why in junk food, there was a lot of trans fat, and that was considered very unhealthy. Why? Because it raised the LDL level in your body. And LDL, we know, is not a good fraction of your cholesterol. So LDL is the only part of your cholesterol which we consider as a risk factor. So that's why avoid trans fats, avoid even in your own home. Don't refry with the same oil, fry next day or the day after. That's something to be careful about. Second is that polysaturated fats are like hydrogenated fats, like vanaspati, like butter. So small amounts of butter is not going to hurt you because your body can consume it. But large amounts of butter will be detrimental. Same thing with cow ghee is better than buffalo because it's lower in fat. If you can find pure ghee, you are in good shape. And we say 2 small spoons, like teaspoons a day of absolutely pure ghee. Cow ghee is good for you because it has got many antioxidants. So I think it's not harmful to have small amounts of ghee or like I just told you, avoid solid fats as much as you can. Solid fats are worse than liquid fats. Now comes the oil, which oil to use, because that's another question that comes up. Especially you said families may be listening to all this. So each oil, whether it is canola, safflower, all this other stuff, has low content of polysaturated fats, but they each have their own problems. So, like I'll give you the example of mustard oil, which is supposed to be very healthy. But mustard oil is the standard oil used in Assam and Bengal. We also know that the highest incidence of pacemaker requirement, artificial pacemaker for the heart, is in Assam and Bengal because chronic use of mustard oil leads to the nerves of the heart getting affected. So what we recommend today is rotate your oil every 6 months. So whether you're doing canola, go to safflower, go to rice oil, so just rotate it. And then any toxins that may be in that particular oil will then disappear. And no 2 oils that we know have the same toxicity. So that's a...
Dr. One, I think this is a very compelling question. If we are feeling that there is a heart attack happening, what type of medicine one should take on the way to hospital or keep at home? Last question.
Take a tablet of aspirin, dissolve it in a glass of water and drink it.
Thank you so much, Dr. Thank you so much for your time. We know how busy you are and how many lives do you save. We are really grateful to you for your time, and we'll get in touch with your team for these kind of tests that you recommended. Okay. Thank you so much.
Okay, thank you. All the best. Stay healthy.
Thank you. So listeners, this was Dr. Naresh Trehan, and I'm sure that you would take home many of his key takeaways in terms of, prevention is better than cure. Genome sequencing is possible now. And of course, the various indications which he has said for breathlessness, sugar, and he's also mentioned that BP is reversible. Diabetes is also, can be managed. He talked about ghee, he talked about flour, he talked about whether a smartwatch is a lifesaver or not, and what to do in case heart attack is happening. So on the way to the hospital, he said aspirin dissolved in water, in a glass of water, and take it. And we'll make available the recording of this webinar. We'll email it to all of you. You can make important points on your own and stay healthy. Thank you very much for staying tuned. Thank you.
Thank you so much for this opportunity, and on behalf of Medanta, I would like to sincerely thank you all for giving this opportunity, and look forward to such event in future also. Thank you.
Thank you, Abhijit. Thank you. And thanks to the office, TRC office, Jyoti and Anil Lalji for organizing this. Thank you.